Okay, so I did my case study on subclavian steal syndrome. Just an introduction of a case study that I found as a peer-reviewed journal. A 67-year-old patient was experiencing syncope and left arm pain with exertion. She had a history of hypertension, coronary artery disease, and dyslipidemia. Her blood pressure when she came in for a visit was 140/80, a heart rate of 70, but her left radial pulse was absent. This caused them to order an ultrasound, which showed some flow reversal of the left vertebral artery. And that ended up leading them to an MR angiogram that was performed and showed an occlusion of the left subclavian artery. So subclavian steal syndrome, also known as SSS, is associated with an occlusive lesion on the proximal subclavian artery, and that results in flow reversal of the same side vertebral artery. And this can cause vertebrobasilar insufficiency. So antegrade blood flow, which is normal flow toward the head, occurs through the contralateral vertebral artery, but then retrograde flow, which is blood flowing toward the heart, goes through the ipsilateral vertebral artery, and that occurs because of the occlusion of the subclavian artery. 80 to 90% of cases involve the left subclavian artery because of the acute angle of origin of that artery, and 80% of people with flow reversal are usually asymptomatic, and symptoms present secondary to arterial insufficiency. So incidence of SSS, males are more likely to be affected. The prevalence of SSS is only about 5.4%, just because a lot of individuals are asymptomatic, and people over the age of 50 are more likely to get SSS just because they're in that increased atherosclerosis of that age group. So the most common cause of subclavian steal syndrome is that atherosclerotic vascular disease. Some risk factors are similar to those of atherosclerotic disease. So that would be smoking, hyperlipidemia, hypertension, diabetes, family history, and age. And then there are some rare causes of SSS, but we won't go into those. So the physiology of how this happens. So there is that proximal subclavian artery stenosis, and this results in lower pressure at the distal subclavian artery. So this pressure difference causes that retrograde flow from the contralateral vertebral artery to the basilar artery and then to the ipsilateral vertebral artery. So basically, the vertebral arteries should have blood flow up to the brain from the aortic arch. However, in this case, because that subclavian artery is blocked, blood flow goes up the opposite vertebral artery, up to the brain, circumvillus area, but then comes back down to supply the left subclavian artery. And normally the blood flow would not do that. So it's basically stealing blood from the cerebral circulation. An ultrasound of a vertebral artery flow. Normal vertebral artery flow is above the baseline, so that would be the image on the top. And abnormal vertebral artery flow, the flow is below the baseline, so that's showing that reversal of flow. Some signs and symptoms of SSS. A sign that can be found in clinic is a systolic blood pressure difference of 20 between both arms. Most symptoms are neurological symptoms just because of that decreased blood flow to the basilar artery. So you'll get lightheadedness, blurry vision, syncope, headaches, things like that. And then also people can have arm pain with exertion or repetitive motions. Diagnosing SSS, most common diagnostic test is that carotid duplex ultrasound. And then from there, they would get a CT angiogram or MRA, is frequently used to officially diagnose. And this picture on the left is just showing that complete occlusion of the subclavian artery. There's no flow going through it. And then this is another image of that occlusion. It's completely black. There's no blood flow going through there. There are 3 classifications of SSS. The first one is grade 1, which is just reduced antegrade vertebral flow. Grade 2 would just be alternating flow of antegrade and retrograde. Grade 3 is a permanent retrograde flow. So this study was shown that as the difference of arm blood pressures increase, the severity of the disease is increased. So this table just kind of shows that relationship. So treatment, most patients have minimal or non-life-threatening symptoms, and those are treated conservatively. And those would be antiplatelet therapy, lifestyle modification, management of hypertension, diabetes, other coexisting diseases. But if patients do have more severe symptoms, there would be a more invasive approach. So there is the angioplasty and stenting of the subclavian artery, which is preferred just because of that faster recovery and shorter hospitalization. And there is about a 93% success rate with that procedure. More of an invasive surgical approach would be the subclavian artery bypass, and normal flow would be restored after the point of bypass. Prognosis is excellent for either of these procedures, but it would be important for the patient to make some lifestyle changes just to prevent any further blockages in their vessels. So just some related diseases. We already mentioned that patients that get subclavian steal syndrome also have atherosclerotic vascular disease, and they may also experience coexisting diseases like hypertension, diabetes, obesity. There is also something called coronary subclavian steal syndrome, which is similar to SSS but more rare. It can occur after a coronary artery bypass surgery, but treatment would be similar to SSS. Just in conclusion, subclavian steal syndrome occurs when there is a proximal occlusion of a subclavian artery, and then that causes reduction of cerebral circulation, and patient will present with neurological symptoms or same-sided arm pain. And history of atherosclerotic vascular disease, age, and coexisting diseases are common risk factors. And while the majority of patients are asymptomatic and treated conservatively, there are more severe cases that will be treated invasively with a 93% success rate. Just with follow-up on the case study that I read on, the patient did end up going through with an angioplasty, and that was successful. They did kind of, they took out some other blockages that she was having as well. So from there, they just changed some lifestyle modifications, and hopefully she will be doing well in the future. And these are the references.